Good morning, Peter Goertz. I'm a psychiatrist. Can our physical problems be a wake-up call to address our emotional problems? In my opinion, the short answer is yes, and it seems that the physical and emotional may actually be two sides of the same coin. For example, if you're having a panic attack, you're most likely going to have a fast heart rate, tachycardia, whereas if you're relaxed, you're most likely going to have a normal heart rate. On the other hand, if you're in physical pain, severe physical pain, let's say from an injury, your mood is probably not going to be the greatest. Whereas potentially if you're laughing, that might help your physical pain. So it seems that there may be no actual boundary between physical and emotional, and they may be two aspects of the same thing, of ourselves. What led me to talk about this is I saw a patient in an emergency room last week, a lady around 40, and she'd been unable to swallow solid food for a month and had lost about 20 pounds in the month, repeatedly had sought medical attention, had not recently been in psychotherapy or gotten any mental health treatment, was under a lot of recent stress and was feeling physically weak. She'd also been through a lot of chronic physical abuse in childhood, severe abuse, not just physical, overall chronic abuse in childhood. And it seemed that there may be an aspect, or at least that a lot of this was related to what we call conversion disorder or functional neurological disorder. And what we want to do to avoid something like that occurring is to try and be aware of our emotional problems. That would be the first step, then work on digesting them. And otherwise, they can bite us, it seems. So otherwise, if we're not aware of them, if we don't digest them, our emotional problems can bite us in the form of physical problems. Namely, for example, as in the situation that I mentioned, functional neurological disorder, hypertension maybe also. So even concretely measurable physical problems can occur if we're not aware of our emotional problems and don't digest them. And even potentially something like a myocardial infarction, so a heart attack. And many people, maybe everyone, is aware that certain stress can affect their physical body. For example, many people, if they're stressed, they might have a headache or an upset stomach. What can help us to be aware of our emotional problems and digest them is psychotherapy. At least that's one aspect that can help. And if, let's say, a person with a history of severe abuse in childhood is in psychotherapy, one thing we want to make sure of is that there's no ongoing, continuing abuse in the present, whether it's emotional, financial, physical, sexual, or abuse at work, which is pretty common also. So our problems, including past problems from childhood, for example, can be literally, in this patient, this may have been the case, our problems can be literally hard to swallow. And I'm not making light of this, but metaphors often can be quite accurate and pertinent. So this patient may have literally found her stress, her current problems hard to swallow, and that had been her major issue, namely difficulty swallowing food for the past month. And that had led to quite a bit of weight loss. Now, addressing our emotional problems can take a lot of time, effort, work, persistence, and there can be the temptation to not do all that and instead use alcohol, drugs, and even prescribed medications like benzodiazepines. They can be used to comfort us, to decrease the distress in the short run. However, in the long run, of course, use of alcohol and drugs and even prescribed medications like benzodiazepines can turn out to be problematic. So in this situation with a patient that I mentioned, it seemed wise for her to go to a psychiatric hospital and get evaluated, and for some psychotherapy hopefully to start. And she was agreeable, and hopefully she'll do well. Thank you.